It seems today that all you see is violence in movies and sex on TV.
But where are those good old-fashioned values on which we used to rely?
Lucky there's a man on the guy. Lucky there's a man who positively can do all the things that make us
Laugh and cry.
He's our family guy.
Peter, you should really slow down. You've already had like 30 hamburgers.
Shut up, Brian. It relieves the pain of mustachelessness. And it's working. I no longer feel the pain. Come to think of it, I can't really feel anything on the left half of my body.
Really? That doesn't sound good. Peter, are you winking at me? Oh my God, someone call an ambulance!
Doctor, what happened? Is he gonna be okay?
Mrs. Griffin, your husband has had a stroke. The left half of his body is completely paralyzed.
Oh my God. Peter, sweetheart, how do you feel?
Had better days, Lois. Had better days.
Dr. Hartman established that Peter had suffered an ischemic stroke and recommended anticoagulant drugs as a treatment. This class of drugs prevent the clotting of blood and is a medication for thrombotic disorders. Peter suffered from venous thrombosis that caused the stroke. He was immediately treated with heparin, an injectable anticoagulant, in the hospital. This flowchart shows the sites of action of anticoagulant drugs. The boxes highlighted in blue shows oral anticoagulants that interferes with post-translational gamma carboxylation of factors 2, 7, 9, and 10. Heparin inhibits coagulation, both in vivo and in vitro, by activating antithrombin 3. Antithrombin 3 inhibits thrombin and other serine proteases by binding to active serine sites. For prolonged therapy, warfarin was given to Peter orally. This flowchart describes the mechanism of vitamin K and warfarin. Warfarin is structurally similar to vitamin K and acts as a vitamin K antagonist. After the peptide chains encoding factors 2, 7, 9, and 10 have been synthesized, reduced vitamin K acts as a cofactor in the conversion of glutamic acid to gamma-carboxyglutamic acid. During this reaction, the reduced form of vitamin K converted to epoxylate, which in turn is reduced to quinone and the hydroquinone. Hopefully, there'll be no complications when Peter takes these anticoagulants. Dr. Hartman discussed that there is a common side effect for both drugs, which is hemorrhage. Especially, the risk of bleeding is increased further when warfarin is combined with antiplatelet drugs, such as aspirin or non-steroidal anti-inflammatory drugs. A serious side effect of heparin is heparin-induced thrombocytopenia, caused by immunological reaction that makes platelets a target of immunological response. There are also two known non-hemorrhagic side effects of heparin treatment: the elevation of serum aminotransferase levels and hypoglycemia. Other side effects are increased potassium levels and osteoporosis. Many commonly used medications interact with warfarin, such as antibiotics. Antibiotics will greatly increase the effect of warfarin by reducing the metabolism of warfarin in the body. Increased effect of warfarin with cimetidine and amiodarone and salicylates. Excessive use of alcohol is also known to affect the metabolism of warfarin and can elevate international normalized ratio and thus increase the risk of bleeding. Decreased effect with barbiturates, rifampicin, and carbamazepine, alcohol, and green leafy vegetables. Peter would need to monitor his blood by having regular blood tests when he's on warfarin.
I hate being all strokey. This is all your fault, McBurgertown. You and your delicious hamburgers. I swear I'll get back at you someday for what you did to me and what you did to Wimpy.
I would gladly pay you Tuesday for a hamburger today.
If only there was some way I could be like everybody else again. How long was I in there?
About 5 minutes.
Why are we not funding this?